Assalamu alaikum. Today I'll be presenting a case report published in International Endodontic Journal in 2025 by you and colleague. The paper is titled with Robotic Navigation System for Management of Pulp Canal Obliteration Case Report. Pulp canal obliteration remain a significant challenge in endodontic treatment. Locating the canal is often difficult, and attempts to gain access may lead to excessive dentine removal and serious complications such as perforation, canal deviations, or instrument separation, even when using the microscope or CBCT. To address these difficulties, static navigations have been developed, which rely on the CBCT and intraoral scanner to plan an access cavity using the implant planning software and a customized stent incorporating a sleeve that guide the burr to the target point. However, these static navigations still have limitations, including no water cooling, obstruction of the operative field, and the need of additional visit. To overcome this issue, dynamic navigations was introduced, incorporating the CBCT and intraoral scanner, but enhanced the precision by using the positioned reference markers. Stereo cameras track these markers in the real time, and the handpiece is equipped with the markers that is registered and sync with the reference systems. And this is allow the real-time guidance and potentially reduce heterogenic errors. More recently, implant dentistry have incorporated a robotic navigation system to enhance a digital workflow. The clinician hands-on involvement is minimized. A pre-programmed robotic arm execute the planned procedures with the high precision and reproducibility. The concept have now been translated into the endodontic as illustrated in this case report. 34 years old male Chinese patient presented with the chief complaint of intermittent lingering pain in the upper left central incisors with the clinical finding of positive to cold test and tender to percussions, and radiographic findings of pulp canal obliterations with partially blunted root apex and widening of the periodontal ligament space. And the tooth was diagnosed with symptomatic irreversible pulpitis. And non-surgical root canal treatment with the aid of robotic navigation system was planned for this treatment. 7 reference markers were selected and calibrated to link CBCT data with robotic arm, and the path of entry was digitally planned from dentino enamel junction through to 14 mm apical to the incisal edge, and ensure straight line access into the pulp space. 3D visualize allow the clinician to monitor in real time. A robotic arm positioned move toward the maxillary central incisors under the operator supervision using carbide burrs operated at 30,000 RPM, and automated drilling stopped 3 mm shorter of the canal entrance. An operator continuously monitor and ready to take control if needed, and canal patency after robotic execution with 8K file confirming the canal orifice. And the tooth was instrumented with true anatomy rotary files and obturated with Getaber Chacon with bioceramic sealers and restored with resin composite restorations. This case report demonstrated that robotic navigation system can provide an accurate and minimally invasive access in pulp canal obliteration cases, conserving dentine and reducing the heterogenic problems. However, clinician role remains central and continuous supervision is required, and the system is adjunctive rather than a replacement for the clinical judgment. Thank you.